Okay, good evening, everyone. Would you all like to stand up for a moment? Maybe just stretch. Been a long afternoon. Can affect you and make you disabled. So let's all stand up and stretch for a few seconds. Put your hands out and up and round and breathe in deeply. And when you're ready, you can sit. So I'm Philip and I'll be chairing this next session. And we have 3 speakers for this forum F4. As an introduction, I was just wondering if you'd all think, what would you think about in your mind when the word aging comes up? What's the first thing that comes to your mind? I know the last 2 speakers spoke about a lot of disabilities. So perhaps, disability, perhaps the risk of stroke and illness, perhaps memory problems. I'm turning 60 this year and I already have aches and pains and lethargy and loss of stamina and I'm a bit forgetful. But can we also think about feeling good about ourselves? Feeling that we have achieved things in our life? Feeling that we have left maybe a legacy, at least for our children, or for our dear and near ones? Or even keeping fit and healthy at this period, and perhaps even engaging fully in life as we carry on. So really it's a choice. We can either be negative aging as we get older, or we can be positive aging. And that's the topic of our next forum. Positive aging is actually an approach that recognizes our mindset and attitude that affects our physical and emotional well-being as we start to age. So this evening we're honored to have 3 international speakers to discuss positive aging. They have their presentations recorded, and following that will be the Q&A session. So let me introduce to you the panel before the presentation. Our first presenter is Dr. Fiona Kerr. And she is the founder and CEO of Neurotech Institute and also of Focus. She's an expert in human connectivity and synchronization, and she consults and researches globally to help build bespoke solutions to emerging complex problems. She holds international board and advisory positions in robotics, business and government sectors, including health, aging, arts and education, AI and design, ethics and defense, and has ministerial advisory roles with Australia and with Finland. She will be speaking to us on designing for positive aging. So let's welcome our first speaker, Dr. Fiona Kerr.
Good evening, my name is Dr. Fiona Kerr and I'm going to talk to you about designing for positive aging. There's a number of things that I want to cover. So we're going to go through how you do think about designing. We're going to go through the indoors. We're going to talk about the public and the outdoor area. I'm going to talk about technology. And then I'm also going to talk about just a few things to keep in mind when you're thinking about designing smart cities. So a lot, but I want to try and do an overview of a number of the things in the 15 minutes. Okay, so the first thing to think about is that designing built environments should be done holistically, because there's so many different things to have to think about when you take them into account. So a number of things are really critical, and we'll look at a couple of them because they really are major enablers for people living longer, healthier lives. They're really critical to people's quality of life. So the sorts of things that they change are how we interact with surroundings and with each other. So can people get to each other? Are they happy and comfortable to do that? They have a high impact on physical and mental health. So the how and the when and the why of a number of different things. So how people meet and engage with neighbours and with their community, getting out there on their own if they're comfortable, how they communicate and how they get information from the environment and they use the services that are in the environment. Are they easy? Do they know about them? Can they get to them? Those kind of things. They influence hugely where people eat, what they eat, and even when people eat and how they eat. They influence how people shop and also how they exercise and the sorts of things they do. And so there's a number of viewpoints to take into account when you think about the human-centric design process for the built environment. So does it fit social patterns of how people connect in that society? Does it fit psychological patterns? So do people feel safe? Do they feel secure? And are they comfortable, or are they embarrassed? Are things difficult to either use or to get around if you're in an environment someone else has designed for you? Do they fit cognitive requirements? Because people's cognitive capabilities change as they age. So you have to be able to alter that and take that into account. Or do they fit the physical requirements of people? So that's the number of stairs, do you have bridges, what kind of signage is around, can people see? What kind of volume do you have to have if things are audible? What do they have to be able to hear? So there's all kinds of things that are important for people. And lastly, but not least, is the aesthetics. If things look attractive and they look welcoming, and if they look interactive and aesthetically pleasing, then people will enter that environment. If they don't, people will not do it nearly as much. We are aesthetic animals. We love things feeling comfortable and welcoming. So what kinds of things do you take into account? So indoors, with a successful kind of design process, because of the new ways that you can use materials and different building practices now, you can change the design as people age. You can actually alter them. So if we look at the picture, there's ways that people of all different ages can get around in this kind of environment. And you can change the spacing around how people move. You can change the heights of what people use. There's a number of different aspects. So I wanted to consider what kinds of variables alter as people age. And that includes things like the social and physical engagement, so their ease of movement and the kinds of exercise. You actually have to get them to move as well. So how easily can they move around in their environment? As their behaviour changes, does the environment they're in fit that new behaviour, that new capability? The functions, so can they reach things to things that they need to find stand out? Those kind of things are really important as you age. And also the care outcome needs. So have they got nice comfy little area, but also are the areas that they need to be able to utilise easy and clear and able to be found and got in and out of as they get less stable as well. So well-being is a really important aspect of how all of this looks together. So is it psychologically safe? Do they feel like this is a place where they are safe and secure, but also are they comfortable? Because that's a really important aspect of being indoors. So the aesthetic features are very important. It's a really important quality, not only for the people involved, but also for the carers and their family as well. And there's a bunch of things I won't go through, but the kinds of things you can think of are everything from size and layout of the environment to big changes in people's psyche and feelings of well-being, and even cognitive capability around colour, lighting, the right noise levels. Some things should be high and some things you shouldn't hear as much. Think of trying to sleep in a hospital. How they can access areas. They need to have access to a kitchen and an outdoor area, if at all possible. And is it homely? Is it pretty? And also you can use non-verbal cues. So you might use different archways over doors to say, this is a communal area, this is a private area, or this is a business area. So there's a lot of ways that you can build things in. And another big change is that the major advances in technology, so I work in smart conditions and smart homes, means that you don't have to hardwire things in. So that means that you don't have to pre-fit technologies nowadays. And it's a maximum capability that you suddenly have in front of you to take all sorts of new technology on board and to adopt it. So before we get to the technology, there's some of the examples that are really lovely are things like thinking about the granny flat or the small home and having environments inside that you can move, change or add depending on the requirements of the person. And then they don't have to be boring. You can have beautiful places that people can live in. So this is Jika. It's a little micro retirement community for women in Japan. And there's a lot of space outdoors. And they've got things like a pool that people can actually roll into if they need to, if they can't walk by themselves. And it still looks beautiful. So you don't have to give up on things looking aesthetically pleasing. So to technology. Whether you call it geron technology, assistive technology, one of the big things I want you to remember is that there's a difference between the Internet of Things and the ICT solutions. So people get very worried about the cyber safety of using technology and getting information onto that. But you don't have to put everything onto the internet. There is a huge amount of capacity you've got with local connectivity that does not go onto the web. And you can do a surprising number of things with that. So all of those things we have in the top area of this picture are all to do with assistive technologies that are not networked. And so you can, because you do have issues of security and hacking and other cyber risks, there's a massive amount of things that can improve life, and also they're very simple and they're very passive, because now that we have the level of IoT that allows you to do things very subtly, they make a big difference. And then you can think about what you network afterwards. So the kinds of things that are now the sort of third level, if you like, Internet of Things, are just they're just located locally. And if you look on the picture, all of the things, these kind of things you can do with a local situation. You don't have to put them on. So third gen is very passive, it's very unobtrusive. It can be cameras, but it's also materials. It can be smart walls, it can be smart toilets, it can be all kinds of things that will pick up information. And then you can augment them with actual active devices. So that's having a wearable, or they're called careables. It's having little interactive robots and other kinds of assistive devices that are physical. So the first level is you don't even see it, it's built in. The second level is something that you pick up and utilize. And then you've got the ICT solution. So that's this kind of thing. That's the left-hand side of the picture, which is things that are connected to external parties. So you can choose what you want to beam out and what you want to keep safe. You can also think differently about how to use technology. So this is a technology which is called Nesterly, and it's a way that older people and younger people can find each other and actually cohabit to get that intergeneral activity. And decide on what they're going to do together and how they're going to do it. So we need to think on how and why people are connecting when we use technology. And are they the right interconnections? Is it timely? And what do you need to have secure? Okay, when you get to the public and common spaces, there's lots of different ways to configure them, but some of the major things to think about are you can do things very beautifully if you need to. So the top picture is a Swedish example of having little tiny apartments next to their big common area. And then this second group is a group in the US, the Lantern of Chagrin Valley, and they actually have this built inside so that people feel like they're in their own little cottage, but it's in an old folks' home. And so there's a number of lovely things that you can do design-wise. When you do create common spaces, in the outside, if possible, you still keep it aesthetically pleasing so that it doesn't look just like a really cold place to be. You also think about, in the environment, have people got objects that they can identify? Do they know where they are, and can they rest on them? And also, if you're going to border off different areas, try and think of things like soft borders with plants, again, aesthetically pleasing kind of aspects to the environment. So the big thing I guess I want you to think about is that design of elderly care homes is what often is called in Scandinavia health supportive design. So they have 4 main things that they've found that support health and well-being in any level of elder care. So the first is, as we've talked about, have a home-like environment. So that is making it as home-like and comfortable as possible through the exterior and the interior of the building. The second is that small scale approach. So it makes it feel like a village, it makes it feel cozy. And when you cluster rooms together, then what you do is you get people interacting with each other. And then you have the garden and nature accessible. So that's a really critical aspect, that courtyard, for a lot of elderly care homes that are successful. If people can get out, even if they can just sit in the sun, even if they can't walk for a long time, it's very positive for their neurobiology and for their physical health. And you have to ensure that it's safe and accessible in ways that people can get out there by themselves. And community integration is the 4th thing that is seen as really critical. So this is an example of having a big eating area, a big public eating area underneath elderly set of apartments. So when you plan clusters of elder care, you don't plan them next to residential areas, you plan them within residential areas. So you have the kindergartens and the playgrounds and the hawker centres and those sorts of things right around the elderly people. And what you're trying to do is you're trying to mix those residents and community members and ensure that there's a flow every day of the kinds of things that come into the facility. So the Kampong Admiralty is an example. So what they found in Singapore was that they would have these modern apartments with a food court and a clinic and a supermarket underneath, but there was no sense of community or belonging. So they thought, okay, what can we do? So what they wanted to do was encourage that intergenerational bonding. So Kampong Admiralty has 100 studio apartments. It has a 2-story medical centre, an active ageing hub. It has a childcare centre. It has about 7 playgrounds in the area. It has a community park and garden rainforest. You can start seeing the size of this building on the screen. And it has a 900-seat hawker centre. And also, they've gone for it being a biophilic town. So it looks really green and beautiful, and it's won a lot of awards. And that's the kind of structure that they've taken to create this this really different kinds of way to go. They haven't got the space in Singapore, but what they've done is try to be very innovative in the space that they do have. So lastly, when you're designing smart cities, the big thing I want you to keep in mind is it's for community engagement. And any smart city that works well, that's the aim. It's not to try and get as much technology into that space as possible. So you need to think of community engagement. It allows people to move around, and can they gain information? Can they feel safe? And can they venture out? So you've got smart paths, smart sensors, smart walkways. You've got all sorts of ways that you can let people know where to go, even when they're starting to dement or not have as good a memory. And then it's interconnecting that local connectivity with the ICT, because you don't have to have everything interconnected. And it also lets people see how things are going and monitor infrastructure. So think about the 4 elements. Think about trying to get as wide a range as possible of electronic and digital technologies. Think about how you're going to and when you're going to interconnect the local with the general. So you can have a walker in a shopping centre that just picks up the shop that you might want. And again, it's not connected to a network. You're not going to get in sort of lots of adverts afterwards or have people stalk you. And then how do you embed the technology, the information you do pick up, into government systems? If you're going to get the data, then how are you going to use it? And you've got to make sure that what you're doing is creating practice that brings people together and enhances that community feeling. So that's what's really important. So in the end, when you're designing for positive aging, it's about giving people confidence. So getting them out of that orange kind of feelings of powerlessness and disrespect, and getting them into the green. So design the spaces and the buildings and the transport and the physical flow and the aesthetics with that in mind. Design to increase mobility and social participation and community support, and make people feel valued in that community, and that they're visible and useful, and that they're enabled to be able to go out and about, and that they belong. Because what you then get is active combating through your design of loneliness and isolation. So it's a really critical aspect of what you're doing. So what you end up doing is maintaining their quality of life and their well-being, and they have positive aging. Thank you.
Fiona Kerr. I think so it feels like we take a lot of things for granted, don't we? Okay, moving on. Our second speaker is Mr. Greg Addy, who I hope I pronounced his name right. He's the director of G88 Consulting. And Greg has 40 years experience in health service as a board director, executive manager, service development planner, and specialist aging well consultant. He's worked across diverse health sectors in Australia, and including acute aged primary care and regional healthcare networks. Using his diverse insights and experience, Greg has also advised aging well businesses regarding expansion and international markets like China and in Malaysia. So Greg Addy is going to talk to us today on training the workforce to support positive aging.
Good afternoon, conference delegates. Thank you for the opportunity to talk with you today about the critical importance of supporting our staff to deliver the best possible outcomes for positive aging. This presentation will be looking at the person-centred principles that our workforce need to practice in their daily jobs. We'll look at the scope of holistic wellbeing and how this fits into our care services. We'll also look at some of the critical success factors and the need for structured systems, how we design, implement and monitor positive aging outcomes. And we must remember too that positive aging applies to the older person's journey across retirement living, home care and residential aged care. Firstly, we need to support our workforce, our managers, staff and volunteers to understand just what positive aging means and how to apply it in various organisational settings. This begins with the international science of well-being so that we can develop evidence-based guidelines for our staff. Secondly, our staff need to understand how to support each older person to age well, to live the best life possible, whatever their situation, whatever their frailty. It's also about partnerships, very much so, between the older person and the provider, so that the organisations are doing it with the older person, not doing it to them, and supporting the older person to maintain choice and control and to take self-determined risks. And also reinforcing the conference theme, it must be holistic, including safety, health and well-being. Ultimately, it's about quality of life, not just care services. To train our workforce in positive aging, there are a number of essentials for success. We need a clear framework with simple communication, not using academic terminology, but using simple concepts so that a busy, hard-working staff member knows what they need to do each day in their job. A very important part of this is co-designing the positive aging processes with our customers and with our staff. Too often, it's organisations that set the process up and control the process without engaging with older people to actually design a system that's best for them. The other critical area is supporting health literacy to enable the older person to make informed choices. knowing what options support positive aging and what options and choices would undermine their positive aging. And we also need specific evidence-based high-impact actions, such as multidisciplinary early intervention teams when a person's health or well-being deteriorates. To develop and maintain a workforce that understands and is committed to positive aging requires a broad, integrated strategy that includes several key elements. We have to provide staff and recruit a workforce that has the knowledge, who knows what it is. They have the skills, they know how to practice positive aging, they know how to support people to do positive aging. And they also need personal attributes, the type of personal skills that help build relationships with individual older people to support their positive aging journey. Secondly, it requires comprehensive and ongoing education. The pre-employment base qualification for the care worker, for the nurse, for the manager needs to include concepts of positive aging. When the person joins our workforce, we need to provide them with additional education to make sure that they're work ready to deliver positive aging in our particular setting, in our particular organisation. And lastly, their ongoing professional development to increase their knowledge, to continue their learning about what positive education or what positive aging means and the education needed to support those outcomes. A very important part of this is that positive aging requires prevention at the front end and re-ablement at the back end. At the front end, it's all about health promotion, supporting the person's health literacy, making healthy choices, making the right positive aging choices. And at the back end, working with that older person to prevent avoidable decline and to support them with re-ablement interventions to regain their health, regain their well-being, and to reduce their frailty. A significant part of positive aging is supporting the lifestyle aspirations of each individual older person. And that's about purposeful, meaningful activities that are important to that person, not a menu of choices decided by the organisation, but the actual choices and preferences of that older person. Staying connected to their family, staying connected to communities, and learning new skills as people age. A very important part of this is to support our workforce to make their job easy with positive aging, to use simple templates. And two of those, for example, are the My Story template, and that allows each worker to understand and know that older person, what's important to them, their history, what their goals are, what their challenges are. The second part of that is a My Wellbeing plan, which is like a clinical care plan, but it focuses on the key components of well-being and develops a plan with the older person to actually maintain their well-being and to support positive aging. And the last part of the workforce collaboration is to make sure that our staff performance reviews include a reference to how well they support positive aging. Quite often we focus on attendance, their clinical skills, the level of complaints, their teamwork, but with positive aging, we must include that in our staff performance reviews. So essentially this is reminding us that high quality clinical care is essential, but it's in the background. No one wakes up each day looking forward and getting excited about having their wound dressed or receiving their diabetes medication. What we all want, older people through the positive aging journey, is meaningful, enjoyable relationships and activities. Workforce expertise in positive aging needs to be supported by effective systems, beginning with standards. So the 10 pillars that have been identified for this conference to support people to live longer, healthier and better That's a great example of the standards that could be used to design a very effective positive aging system. Other examples of standards are the positive psychology elements of PERMA around positive emotions, engagement, positive relationships, a meaningful life, and celebrating achievements. But we need to start with standards and then build our policies and procedures around that to guide staff practice so that the organisation makes a commitment and staff understand what they need to do to actually support positive ageing. The third element of this is building and developing operational systems, the enablers of positive ageing, and this guides staff in what to do and how to do it. And an element of that is technology, our digital transformation that supports and makes that daily work of our staff that much easier in delivering positive ageing. As we talked about previously, education is an ongoing element of this effective system. We need to repeat the education, to reinforce it, and to reward staff behaviour when they demonstrate good, positive ageing supports. It's also very important that we have clear measures that both the organisation and staff can see how well we're doing in building and developing a very effective positive ageing processes. We need to monitor and evaluate those outcomes. What's working well, we need to lock in. Where we need improvements that are shown through our evaluations, then we must work on that. It's very importantly, this is a continuous learning process, both for our staff, for our organisations, and also for our nations in terms of how we learn from international experience. So, in summary, the best systems to support our workforce to develop the most effective positive ageing outcomes for our older people, for our elders, is by using best practice models, looking at our international examples, looking at our national frameworks, use that to design our best practice models aligned with our culture and our community and our history. We need to co-design those processes with our customers, our older people, and with our staff. They must be supported by very strong systems that we plan, implement, and evaluate our positive ageing processes within our organisations and our staff practices. We need to constantly monitor, measure those outcomes, and evaluate how well we're doing against those standards and against our aspirations for positive ageing. And most importantly, it's about continuous learning, sharing our experiences, learning from the best, and adapting our previous understandings. Thank you very much.
Thank you, Mr. Greg Addy. Shall we give him a round of applause, please? And finally, our third speaker in this series of positive aging. Let me welcome Luke Westenberg, who is the president of Aging Well International and the CEO of Aged Care Industry Association. He has worked in the Australian federal government, managing programs exceeding Australian 100 million annual budget. And with postgraduate qualifications in politics and economics, he is skilled in developing and analyzing policy frameworks to drive positive aging outcomes. So he will speak to us on positive aging considerations for policymakers and the government. Mr. Luke Westenberg.
Good evening, everybody. Thank you for coming along to the session today. As you can see, we'll be talking about the sort of issues that policymakers and governments might need to bear in mind when looking at the aging population and how we can make sure that's a positive experience for everybody. I'm Luke Westenberg, president of Aging Well International. So I'm coming from a bit of an Australian perspective, but I think it's important that we acknowledge that there's a lot of lessons from around the world, and I'll share where I'm coming from. So, as I think everybody would agree, there are a lot of policy challenges being posed by the aging of the global population. It's happening around the world. It's not just confined to any particular area. Obviously, it's a very significant shift in our organizational structure, both as a society, as an economy, and our politics as well. Whenever you have this sort of very large demographic change, it tends to be reflected in a lot of population and societal changes. Clearly, that requires new products, organisations, and regulations. I feel there are three key questions that policymakers need to be thinking about and that we need to take into account when we're looking at population ageing and what that's going to mean for governments. So obviously, first of all, we need to be encouraging new service and support offerings. With a significant population ageing, we obviously need new things in place, new products, new services, new ways of organising so that we can meet the new needs that this new population has. Secondly, in addition to encouraging these new offerings, how do we make sure they are actually aligned to what people want and need? We have a lot of experience, and I can certainly, there's some examples from Australia of developing policies or products or directions that in the end turn out not necessarily to be what the consumers, what the older people, what families or society actually wanted. And so then you end up having to rejig things and go through a change process, which can be a bit of a challenge. So ideally, we want to make sure that we have an understanding of what people want up front. And finally, how do we encourage older people and their families to adopt new approaches to ageing? Australia is perhaps further down this path than some other countries in our region, where we've had an older population and more governmental engagement in ageing over a longer period of time. But wherever you're coming from, wherever you are, it is a big societal shift. And there's a lot of expectation management in this change that needs to be worked through and to ensure that everybody feels comfortable. So I'll take each of these in turn. So number one, how do we encourage new service and support offerings? Now, at the end of the day, that means we're going to need new things, new structures. So how can we signal then to the market, or however we wish to conceptualize it, the ecosystem who will develop new products, new services, new service models, how can we signal to them that this is a new and growing area? So there's a range of approaches that have been taken around the world. In Australia, for example, we've tended to have Commonwealth government subsidies and regulatory structures to provide services to older people. But there's also a whole lot of non-government activity that's coming along. And in many cases, you might find that some of the new developments actually come from the non-government sector and can then be supported or encouraged or applied with government support. Another challenge is that you need long-term investment. And as we've heard earlier today, the built environment is a very large part of successful and positive ageing. We can't achieve a positive ageing built environment unless we have long-term investment. Nobody's going to build a whole new urban design approach if it's only going to be used for 3 years. You can't build anything constructive there. The other angle is, of course, staffing. If you're caring for a person, you could have the best built environment in the world. If there's nobody there to provide the support and assistance, then you're not going to get very good outcomes. And you would have heard from Mr. Greg Adey talking a bit about staffing and workforce issues. The key thing I want to note here from a policymaker perspective is that we need long-term investment in staffing. If we're going to have 20 or 30 years of supporting and working with a large older population, we need 20 or 30 years worth of investment in staffing. We can't simply give people 6 weeks training and think that now that's done. We've got a care workforce. It takes a long time to develop that, and we need to sustain that investment as we develop. So then there's how do we guide the development of products and services? And again, that talks directly to signaling that we should see some new opportunities and there are new career paths, and we want people to bring up new products, consider new areas where they could be employed and all that. At the same time, we want to make sure that governments and policymakers can guide it. I don't know that there's anyone in the room who would recommend that what we really want is to have governments step away and leave it all to a market approach or leave it all to individual arrangements. So then governments and policymakers do need to be thinking through how they can provide guidance as to what's going to be effective. And finally, this is the perhaps least exciting one, but extremely important. How do we keep the costs sustainable? Now, at the end of the day, all of these new products are going to have to be paid for by someone. All of these new services are paid for by someone. So is that the older people directly? Is it their families? Is it government? Somewhere across society, there are costs. And the other key angle for policymakers is to ensure that those costs are managed and kept sustainable. Second question, and this of course does link to the first, is about aligning the offerings to people's wants and needs to make sure that we've got the incentives for new structures, we've got a sense of how we'll guide it, but where do we guide it to? And that's where this one comes from. So one of the big challenges is actually understanding what people want and need, because this is a new demographic that we're talking about. Historically, we haven't had a very large older population with often significant disposable income who might be retired and have a fair amount of time on their hands. So we need to try and tease out what are the services, what are the products, what are the structures that are actually going to be of value to this demographic. To some extent, you can ask people what they want, but I do always think of the story about Henry Ford in this context, that where he was reported to have said, if I'd asked people what they wanted, they would have said a faster horse. I think the truth there is that when you're talking about new products, people don't always know what the new product will be. So then we need structures to engage as to where are the areas of need, what are the things that people are not getting that they would like to get, and how can we then communicate and support that. How can we find out? There's a whole range of approaches. In some ways, you can give people freedom to introduce products and see what's used, but in other ways, you also need to ensure that you're actually engaging people in a long conversation. Then the next two questions are obviously very closely related, and this comes down to basically what is the role of government within this space. In some ways, in some areas, people may well not need government to be involved, and policymakers just create a space where consumers and producers can connect and engage, and that's all that's needed. In other areas, that approach doesn't work. And again, taking the Australian example or Australian context, if you're looking at care and support services for people who might have significant dementia-related care needs, obviously you can't simply give them money and tell them to buy the products they need. Or if you're looking at things around providing large-scale accommodation, there are very significant economies of scale. From a government and a policymaker perspective, you want to ensure that you're actually structuring things to realise those economies. There is, of course, the other issue. What people want and what they need isn't always the same. And sometimes as a government or as policymakers, we need to engage with that tension and accept that people may want something else, but in fact, what would be best or what's achievable or what's sustainable, what they need, could be something different. And then question 3. So conceptually here, we've decided with the first question, what it is, how we're going to engage with society, with producers, entrepreneurs, developers of new things. Then we've decided how we're going to understand what it is that we want to encourage these new entrepreneurs and developers to develop and what new services we want. And the last piece of the puzzle is how do we then get the consumer group, the older person, their families, society more broadly, to work with, to accept and to adopt these new approaches. Historically, as we would know, human society tended to operate on the basis that older people were cared for by their children or possibly their grandchildren. As we've moved into an industrial world with an aging population, these old models are coming under increasing pressure, and there's a big societal shift underway as a result. Part of what's needed is the managing of expectations. if we are having a professionalised, structured, governmentally supported system to manage and promote positive ageing, then we also need to ensure that families are no longer feeling that this is a dereliction of duty on their part. That as a society, we're now changing expectations. Older people won't necessarily be cared for solely by their families. There will be other options available to support and to assist and to extend the care and support that their families can provide. So we need to ensure that families and children feel that they are still doing their duty, being good children, caring for parents and grandparents as they ought. And we also need to ensure that older people feel that they are still valued, they are still getting care and support, they're able to connect with their families, but that we might be structuring things in a different way. So obviously, therefore, we can talk about promotion of positive aspects. And you can see this everywhere. In Australia, there are a whole lot of aged care providers who do a lot of advertising about the positive lifestyle aspects of aged care products or retirement living products, of people doing things they want, golfing, all those sorts of things, rather than washing dishes. So we can promote these new products, these new services, create better options than may have been available in the past. But we also need to acknowledge there are some challenges. We should be providing support there as well. And then another extremely important aspect, and I'll talk to the Australian experience again a little later, is giving confidence in the services that are being provided. So then, as a policymaker or a government, we need to be thinking about what regulatory structure is needed, what's going to be the most effective in achieving high quality for our older populations. Do we want to specify quality regulation? What are the standards that must be met? What are the services that must be provided? How will we measure those? Do we want to regulate price? You can only charge up to a certain amount, or do we want to leave that free? Regulation of service specifics, again, that's saying, so for example, in Australia, in residential aged care, there is a schedule of defined care and services, which outlines what must be provided within the Commonwealth's funding subsidy. So as a policymaker, we can ask ourselves, is that helpful? Do we want to specify quality? Do we want to specify price? Do we want to specify service? Do we want to specify all of those? Some of those? None of those. So moving from the abstract to the concrete, I can talk a bit about the Australian experience. So in Australia, aged care services are largely regulated and funded by the federal government. State governments have a role in retirement living products, but that's for people with lower level care needs. It's really just people who want an easy care living arrangement. Aged care in Australia comes in basically two streams. There's in-home care and residential care. The Commonwealth regulates, structures and funds both of those. Where it's been interesting, the Commonwealth does regulate quality, the Commonwealth does regulate price, and the Commonwealth does, to some extent, specify what services need to be provided. So on the three questions that I was asking about regulation, Australia basically says yes to all of them, historically. Now, this leads to some interesting areas. So first of all, regulation of price and subsidy is challenging. So Australia provides a subsidy to non-government organisations to provide aged care services. This throws up a challenge in that if the subsidy and pricing are set too high, then there can be some community concern about excessive profits going to aged care providing organisations. If the return is set too low, it's not an attractive investment option. And as we discussed earlier with the need for long-term investment, that leads to challenges in meeting the service expectations, providing the breadth and the size of the service that's needed. So funding levels are challenging. I could really have talked for an hour about that. Also, of course, so is quality regulation. So Australia has had several different organisations and structures to manage quality in aged care. At the moment, we have the Aged Care Quality and Safety Commission, which has 8 standards and it monitors compliance against those standards. One of the interesting wrinkles there is the tension between subjective and objective measures of quality. That comes down to things such as an objective measure is hand hygiene. Do the staff have appropriate hand hygiene, or are they in fact not washing their hands correctly at the correct time and therefore creating an infection risk? That's objective. You can say that they do or they don't. Subjective would be things around, do I like the food? We all have different tastes in food. Or do I like to have a shower in the morning or in the evening? There's no definitive answer that one is right and one is wrong. But as a consumer, this affects my perception of quality. So then we need to have a system that gives attention and weight to my subjective feelings as a consumer, while also maintaining fairly strong objective measures. So that's an interesting challenge. And then what people want, very difficult to know sometimes, particularly in an environment where we don't want to be saying that there's unlimited funding, consumers can be charged whatever they might want to be, and governments will provide unlimited funding. We all know that's not the real world. And so then the challenge is to get a sense of what people would like and how to match that to limited resourcing. There have been cases where there's been consultation and turns out that what people want is just a lot more than what's currently funded. So that is difficult to then reconcile that feedback with limited resourcing. Finally, more of a philosophical one, what's the role of choice? If I have more money, should I be able to get more because I can pay more? Should I pay more for the same service? Should I pay the same as everybody else and I can't use my additional money for more services? It's an interesting question. There are arguments both ways. The Australian system, again, falls a little bit halfway between, where some of the fees are related to the person's income and assets, and some of the fees are set regardless of income and asset levels. There's some scope to pay extra to get extra services, but that's not an unlimited area. So again, the interesting thing in the Australian experience is it tends to be a little bit one way and a little bit the other way, which then makes it an interesting one where you could argue there could be scope for tweaking, but we can see as a bit of a case study how that all looks. Thank you very much. I look forward to questions.